Talkline Network Radio, America's longest-running Jewish broadcast network, the voice of the Jewish community.
Welcome to the podcast.
You are now tuned in to this episode of our podcast. Today we are going to interview some of the greatest and most influential minds in our field. And now, please welcome your host.
You're listening to Talkline with Zev Brenner, America's premier Jewish broadcast on the air since 1981.
And we're back. One of the things that we should be more involved with, of course, is health issues and there's certain diseases or cancers that really affect especially Jewish people. One of them, of course, is breast and ovarian cancer. Our guest, Elana Silber, MBA Chief Executive Officer of an organization called Sharsheret, which means chain in Hebrew. They're a national group that supports Jewish women and families of all backgrounds facing breast and ovarian cancer. Elana, welcome back to the program. I can't believe it's a whole year since you've been with us.
Well, thank you so much for having me. It's one of the highlights of my year, so I appreciate the opportunity to share Sharsheret with your listeners and your viewers. It means a lot to me. Thank you.
No, thank you. It's important because, listen, we can all do a lot more to prevent different kinds of cancers and illness. I know Sharsheret is, while you're involved with those that actually have the cancer, but you're also involved with families and helping preventive. So I know it's been a very tough year for the organization between what's happening in Israel, and I think more and more people are utilizing your services. So tell us about Sharsheret, what it does, and tell us about what this year has been about, because I know it's been a tough one.
Yeah, so first of all, I mean, just so people know, Sharsheret is in the U.S. and also in Israel. We recently opened an office, I think last January, so over there about a year and a half. And Sharsheret does basically four things. We provide emotional support and patient navigation, so helping people build their medical teams, find out what their diagnosis means, where to go, what to do, helping them make informed decisions. The second thing Sharsheret does is provide mental health and genetic counseling. We have professionals on staff. These are not volunteers. These are social workers and genetic counselors who are speaking to thousands of women, men, and families every day. We provide financial assistance for low-income cancer patients. Cancer is expensive. Sharsheret can help alleviate some of those expenses. And we provide life-saving education. We're doing about 900 educational events starting on college campuses in local communities, educating people about their risk for breast cancer and ovarian cancer. And like Zev says, the measures we can take today to protect our future. It is a hard year. It's a hard year for the whole Jewish community, wherever you are. And we're feeling it. I mean, we can imagine what's been going on as far as what's going on in Israel. And now our team on the ground has been trying to help families who are struggling, running in and out of safe rooms, having loved ones on the front lines, not being able to manage a newly diagnosed woman. Where does she turn? Who does she turn to? Her family is overwhelmed with what's going on with the war, but also she needs to take care of her health. So our team can come in and really help them get things on track without burdening the family. The numbers of women and men and families reaching out to Sharsheret in the U.S. has also been on the rise as we continue to share information and appear on podcasts like this one. People always call afterwards, and we are managing that by having long hours. We have people in Los Angeles and people in New York and everywhere in between, and Chicago, so that we can meet all the time zones, and now in Israel.
No, I'm sure, especially in Israel, and they're dealing with all kinds of issues because as the war winds down, you have more stress. I'm sure stress is also a factor in leading to cancers, including breast and ovarian cancer, and you have PTSD syndrome. You have a lot going on, so Israel needs a lot of help, but a lot of people are in stress here too. And I would say stress is probably a factor, not I'm saying the factor, but a factor in cancer and other illnesses.
Yeah, I mean, we talk about overall behavioral health. Like, it's really important, especially when it comes to cancers like breast cancer and also ovarian cancer. Healthy living is a very strong component in preventing cancer and also from healing from cancer. So there's an emphasis on eating well, diet and exercise. There's a big craze now with this GLP-1 drugs, and we did a webinar on this a couple of months ago about the benefits of this. Obesity is a very strong risk factor for breast cancer and other cancers. So it's, GLP-1 drugs, it's not only about vanity, but also health issues. And we tackle those kind of questions and helping people live healthier lives. We have mental health professionals who are on the call, on eager to help people. And there is definitely in Israel and even in the US, there are shortages of genetic counselors and also mental health professionals. And Sharsheret provides these services at no cost and at the convenience of people who need, people need after hours, people can call from their homes. They don't have to come. It's all about convenience and addressing it to reduce the stress and really encourage healthy living.
Let's talk numbers. I know that certain cancers, such as breast cancer, affect Jewish women more than other ethnic groups. Let's look at the numbers in general, and especially the Jewish community.
Okay, so 1 in 8 women will be diagnosed with breast cancer. 1 in about 70 or 80 will be diagnosed with ovarian cancer. But 1 in 40 Jews of Ashkenazi descent, that's both men and women, carry what they call a BRCA, a BRCA gene mutation. So if a woman carries a BRCA gene mutation, she has up to an 85% chance of developing breast cancer and a 40 to 60% chance of developing ovarian cancer. In the general population, it's only 1 in 400. So Jewish families are at 10 times greater risk for these mutations and then increasing their risk for hereditary cancer. And for men who carry these mutations, it increases their risk for male breast cancer, prostate cancer, pancreatic cancer, and melanoma. And women also who carry the BRCA mutations also have an increased risk of pancreatic cancer. So the Jewish community has these urgent concerns, and we have an opportunity to really take hold for this. Like, we can do screening for these diseases and catch diagnoses early, or maybe even prevent them by doing certain surgeries, taking certain medications to prevent these cancers from actually happening. We don't have to wait for cancer anymore.
Do we know why Ashkenazi Jewish women, especially, and some Ashkenazi men, are more, why they have this? Is anything be done with far as this gene is concerned?
I mean, I think it's the same as all other Ashkenazi Jewish diseases that you tend to marry within the same community and perpetuating the genetic mutation. We're actually seeing a lot of intermarriage between the Sephardic community and the Ashkenaz community. So even before they had some BRCA BRCA mutations, we're seeing more and more in the Sephardic community. So we're also raising awareness there about their risk and making sure that they also are taking care of their health and screening and talking about these cancers.
Wow, I didn't realize it was growing in the Sephardic community as well.
Yeah.
Yes, we always promote that people should be married between Ashkenazim and Sephardim, but one of the risks is that you have some of the Ashkenazic diseases and genes, I guess, gets transferred also to the Sephardic population. Interesting.
Yeah. And I mean, the opportunity to talk about it in communities. So when we talk about genetics, it's still only, with what we've already been able to discover, only 10% of these cancers are attributed to a genetic mutation. Most of the cancers, while we think there might be a genetic component, they have not been identified. So everyone, whether you carry a mutation or not, really needs to be on top of their health and go for regular screenings. And we tell people at every age what you should be screening for. And we work with the medical community. They create screening plans for families who are seeing cancer but may not have a mutation, but that's not the end of the story. And it's really important to keep up your screenings and go to your doctor's appointments, even if you don't have a genetic mutation. And even if there's no family history, but certainly if there's family history, you really have to be on top of those screenings.
Is there any age range that people have to be more vigilant?
So there are, like, everyone, the magic number for women is 40 for a mammogram. But if someone in her family, maybe her mother, her sister, was diagnosed with breast cancer at an earlier age, they start those mammograms 10 years earlier. So if a mom was diagnosed with breast cancer at 39, her daughter is going for mammograms at 29. And there are a lot of screening modalities for breast cancer. A combination of ultrasound, MRIs, and mammograms, but ovarian cancer has no screening modality. So with ovarian cancer, it's really important to speak to a gynecologic oncologist about what you can do to protect your health today, because there is no mammogram for ovaries and ovarian cancer, which they believe is probably starting in the fallopian tubes and not in the ovaries. But again, there's no screening modality. So that is a cancer that really people have to be very aware of their family history and understand their genetic status.
Our guest, Elana Silber, MBA Chief Executive Officer of Sharsheret, a national organization that deals with breast and ovarian cancer. Are there any statistics, Elana, regarding the kinds of women that are more susceptible in the Jewish community? For example, do Hasidic women have more of a chance than, let's say, secular Jewish women? Do we have any data as far as that's concerned?
There's no data on that. I mean, the data we have is about the incidence of carrying the mutation within Ashkenazi Jewish families. And we know that there are certain risk factors that increase your risk, like obesity and aging. Breast cancer and ovarian cancer are more common as you age, but they do happen with younger women. And that's why when women think something's wrong, bring it to your doctor. You are your best advocate. Call Sharsheret. We can help you with that. And look, there isn't a woman out there who doesn't have a concern, a fear at some point in her life. Sharsheret can be there for you at that time too, and help you figure out what to say to the doctors. But again, being your best advocate is the best advice. If your doctor says it's nothing and you feel it's something, it's okay to go back and ask. It's okay to get second opinions. Nobody gets insulted. That's the way it works. And it's really important to know your body and know your family history.
But you're saying if you see something, say something.
Yeah, I mean, we'll take it from that's the New York Police Department, but it's true. If you feel it, so many people that I speak to, especially from the younger population, it's not so common in younger women. So you do have to kind of push, and like a lot of times it might not be anything, but that's okay. You're not wasting anyone's time. You are definitely taking care of your health, and that's okay.
So you mentioned that in Israel, you have more strength because more and more people are utilizing your services due to the war. In the United States, more and more people are utilizing your services. So let me ask you a $64,000 question. Who's paying for your services?
So look, Sharsheret's been very fortunate. The community as individuals have come out and support us. We have had support from pharmaceutical companies, but this year is extremely challenging with the change of administration and different cuts in research. We're feeling the hit. The pharmaceutical companies are more concerned about what the future might bring, and so partnering with them has been more challenging. So we are looking for additional funding from institutional funders in the Jewish community. We don't really get a lot. We're not a federation agency. We're completely independent, and we are looking for additional support. I mean, the best thing for us is that we have a lot of donors who give small, which is good because every donor is a potential client. So we have an opportunity to educate them about their risk. But at the end of the day, Sharsheret would definitely benefit from larger donations and an increase in number of donations.
No, it's important because it sounds like you have more needs. You're going to be hiring more people from what I can glean.
Yeah, I mean, there is no other organization out there that does what we do. So you can imagine that the demand for these services all come back to Sharsheret. There is no other Jewish national organization addressing the issues of women, men, and families of all backgrounds, and certainly not providing over $1 million a year in financial assistance. I mean, we're doing that too. And we're partnering with thousands of doctors and community organizations to try to get people to support when they need it. And the good thing is that once you get through this, most people are doing well. So there's a light at the end of the tunnel, and Sharsheret really provides that optimism and that hope for the future, that these are things that you can live with it. You can live with serious illness for a while, and you can go back to a normal life for most people, but not for everyone. Of course, there are cases, but most women at Sharsheret are doing well. And so it is a very hopeful place to work, to share information, and for people to join as a community. And for us, the community aspect is really the essence of our name, of Sharsheret, of the chain, connecting one with another to support each other and strengthen that chain of support to hope for this healthier future.
So as you're speaking, I mean, we may have discussed it in the past, but I'm sure there's always new inroads. Are there new developments that make it easier to those that already have breast cancer, that there are better treatments or better ways of eradicating this cancer? Is there any new research or any new developments that have come out?
So the good thing about breast cancer research is that it is a very highly researched area. So there are new drugs coming out all the time, and also new ways to provide treatment to women going through breast cancer. There is not one breast cancer. There are thousands of different versions of breast cancer, and many opportunities to treat it in many different ways. So there's a lot of hope that people can try different ways to treat their cancers and get to a healthier outcome. And so we're very fortunate with that. And we do stay on top of, we have webinars talking about the latest research so people can see, and also improving quality of life while you're going through the cancer treatment. There's new stuff coming out all the time, and we definitely are sharing it, and we encourage everyone to come to our website. We have these webinars where you can click on a topic and learn more about the new research that's coming out. And we participate. We go to the San Antonio Breast Cancer Symposium every year and ASCO, and that's where they share the latest information about treatments and research and surgeries that can, mitigate a diagnosis, prevent a diagnosis, or cure a diagnosis.
Now, before you mentioned something about men, the men can also get breast cancer. Most people think to believe that it's a woman's issue only. How prevalent is it in men, and is it growing, or is it the numbers about the same? What are you finding?
So male breast cancer is much less common than female breast cancer, and the statistics are increasing a bit, but raising awareness about this is critical. So, for example, and we'll probably talk about it in a minute, we are having an event next week, or maybe it's a little less than 2 weeks away, where the guest of honor, talks about a family history where his father was diagnosed with breast cancer. So and then within him sharing that information, I got a call from a man who said, you know what, I had the same story with me. So we're hearing about it more, and men are coming to Sharsheret and saying, if another man calls you about this, because we never got a lot of calls like this, I'm happy to speak to them and be a peer supporter. So that's been really very uplifting for us, finding people, men who've gone through breast cancer, but also men are calling Sharsheret because, like we talked about with the BRCA gene mutation, men, number one, they're passing it on to their daughters. And number two is that it increases their own personal risk for male breast cancer and prostate cancer and pancreatic cancer and melanoma. So they also have to be aware of that. So we're making a concerted effort to really raise awareness among men by having this guest of honor share his personal story. We have a men's leadership council. And a lot of our language, we have a special area on our website for men. Look, it's probably hard. I can imagine it's a hard call to make to Sharsheret when you're a woman diagnosed with breast cancer. With a man, because it's perceived as, and it is mostly a woman's cancer, this is a hard diagnosis, and psychologically is also challenging. So we have mental health professionals who have experience speaking to men, and really helping to cope with this diagnosis that is not so common.
Do you also deal with prostate cancer?
So we do, from an educational perspective, every November, which is Movember for men, we have an initiative to raise awareness about male cancers, and we talk about prostate cancer because it is one of the cancers that are increased because of the mutation, and we'll have urologists sharing information, and on our website you can access information about prostate cancer.
Now, you alluded to, while you were a public organization, you really don't do a lot of fundraising events, except in the summertime.
No, we really focus on educational events because, like I said, we're doing over 900 educational events a year.
That's a lot.
It's a lot. I mean, I don't even know. When I saw the numbers, I was thinking, really? Wow. A lot of it is volunteer driven, which we are so grateful to the volunteers who are really giving their time and their experiences. And fundraisers, we do, one in a community a year. And it's a fundraiser, but also a friend raiser. The funds are critical to continue what we're doing, but we want everyone in the room because at the end of the day, everyone has a question and everybody can do something to protect their health. So our goal is to get as many people in the room so that we can help more people. At the end of the day, that's what our goal is. We want to improve more lives and save more lives. And we do with these events. These fundraisers bring in people who never knew that they had a risk or never knew there was anything they could do, or are going through something now but didn't realize they could reach out, and it's life-changing.
No, it's important. Now, I know you do one in New Jersey, one in the Long Island area. Tell us about that and how people can get involved with Sharsheret.
Yeah. So we are doing these, what we call back-to-back events. We are doing one on July 29th at the Rockley in northern New Jersey. And we are doing one in Long Island at the Sephardic Temple in Cedarhurst. And at these events, you really hear first story testimonials from people who've been diagnosed with cancer or at increased risk. You hear from medical professionals. One of the medical professionals that we are recognizing in New Jersey, she is a CEO in biotech, and she was on the team that developed a life-saving drug called Keytruda, and we'll be recognizing her. So people coming in the room will learn from her experience and be also moved by the stories that we hear. The other person, our guest speaker, is a young woman who went through breast cancer, a professional, a dentist, and sharing her experience and really explaining what she was going through and how Sharsheret got her to the other side. And these are important conversations because when you look up and you see these people, you see themselves in you, and you see the medical professionals that are taking hold of the situation and will save your life. So Sharsheret brings together the community and the medical professionals for these kind of evenings. And, you know, for us, it's about getting as many people in the room. So I would love for people to come. It's during the 9 days when a lot of people don't eat meat, and we'll be doing a Siyum service. And this year's particularly meaningful because our founder, Rochelle Shoretz, passed away 10 years ago.
Wow.
And so this is her 10th Yortzeit, her 10th anniversary of passing. And her boys, who were 3 and 5 years old when she was diagnosed the first time, will be presenting the Siyum in her memory. And they're men. They are men now. And to see them come up there and, you know, do this tribute for their mother, and for their mother to have this legacy. Her boys are incredible, and also the organization that from which the foundation of what we built everything on, it was all because of her vision and her mission.
Well, she also gave birth to the organization.
Yes, she founded it.
Yeah, well, and did incredible work, and you've only expanded and grown and helped so many more people over the last 10 years and beyond. If people want to learn more, how can they do so? Where can they go? Where can they call?
So sharsheret.org online. You can also call us 866-474-2774. We also are on social media, Instagram, Sharsheret Official, and Facebook, we're Sharsheret, the organization. And you can also sign up for the events. It's called like Tri-State Barbecues or Tri-State Benefit. When you go onto our website, it's on the homepage. You can find it, but you can also call us. You can email us, info@sharsheret.org. Like however you want to reach us, that's our mantra. We are wherever you are. All our services are available remote and free where you are. So whether you're in your office or you're at home or you're in the hospital or you're in the car, you can reach Sharsheret and get the services that you need. We mail everything directly to your house. You never have to come to our office for anything you need. We know that when you're dealing with a cancer diagnosis or you're going for screening, you don't have time, and Sharsheret can ease that by getting everything to you where you are and how you want it.
Elana Silber, MBA, Chief Executive Officer of Sharsheret Organization. Keep on the important work that you're doing. It's really life-saving and making, it's not just the women, but it's also the families that you're helping too. So people think of it as an isolated one individual. It's really a whole family that benefits for what you're doing. And that means a lot to them. And I know I've been to your events in the past, really wonderfully done events, and you see people speaking from the heart.
Yeah, and I hope you'll join us, and I hope everyone on this call, again, go to sharsheret.org and click on the events and Tri-State Barbecue 2025. We would love to see you there, and it could save your life.
Elana, thank you.
Thank you.
Thank you for tuning in to
Talkline with Zev Brenner, America's premier Jewish broadcast, the pulse beat of the Jewish community.
For continuous Jewish programs, TalklineNetwork.com, or our 24-hour-a-day listen line at 641-741-0389. For past shows, you can find us on iTunes, Spotify, Amazon, YouTube, Instagram, and all major podcast platforms, or jewishpodcast.org. Thanks for listening to the TalklineNetwork.com.
Follow us on Facebook, Twitter, and Instagram.